So I suppose a little fitting that we have Dr. Ernest Hilaire on today here at the lunchroom. Of course, you would know him as the Member of Parliament for Castries South. He's also the first deputy political leader of the St. Lucia Labour Party, and he has also held many, many hats in his professional career as well. Thank you so very much for joining us, Dr. Hilaire.
Thank you very much, Alex, once again for being your guest. I'm certainly looking forward to a very informative discussion today.
Well, maybe you should put yourself back to the 30th of January 2020, Dr. Hilaire. And, of course, that announcement coming from the World Health Organization, WHO. You probably were seeing what was going on in Wuhan, in China, in some parts of the world already, the early spread of the coronavirus. You may have also witnessed the massive undertaking of the Chinese government setting up hospitals in a matter of days. Would you ever thought that it would have come to this right about now, that what we're seeing in St. Lucia on that eve, we've now 1,106 total confirmed cases, and it's all happened pretty much over a period of a month or less. We've had about 750 cases for the month of January. We now have 505 active cases. Unfortunately as well, 13 deaths to date, and the death rate still seems to be going up. Did you ever think that we were going to get to this point here in St. Lucia?
Absolutely not, Alex. In fact, if you go back to the 1st of January 2020, none of us thought the world would have changed the way that it changed. We heard about this virus outbreak in China, and everybody thought that it is something that was localized and would have been contained by that. And of course, people saw the signs of the Chinese government preparing those field stations, those hospitals, and wondering, but what the hell is really going to be happening? Why are they doing that? And then, of course, we heard the United States had a few cases. I think the first was in Seattle. And then we heard about the 15 cases, and President Trump saying the 15 cases will disappear, will go away. And, of course, within a couple of weeks or so, there is the announcement of a black pandemic, meaning, of global proportions rather than an epidemic. And then people realize that this thing is really going to hit us. But I don't think anybody really believed it would have been as dramatic as it has been for the last year. I mean, the fact is not just the number of persons dying, but the fact that the consequences of the disease is that people get sick and they overwhelm the health system by the sheer number and volume of people getting sick. And therefore, that has catastrophic consequences for any national health infrastructure. Certainly by mid-year, despite our back and forth with the government, we really still did not believe it would have gotten as bad as it is now. We were always calling on the government to take certain decisive action to ensure it never gets as bad as that. We kept saying to the government to be very cautious about opening up the borders. We warned the government about allowing persons from virus-stricken countries from coming into St. Lucia. We warned the government about opening up in the way in which they were doing it. Not that we were against the opening up per se, but the manner in which they were doing it. We called on the government to do more testing. From very early, we spoke about testing capacity and the need for us to get a true picture of what is happening in our country. And I think in many ways we went through a lull, a point where it seemed that things were under control, and the government, of course, was boasting that they have this under control. You can't boast your success. And we kept saying to them, you really ought not to be boasting yet. We need to be better preparing ourselves for what can happen. And in a sense, they did not listen. They really did not listen. I think they got more arrogant and boastful. And the consequences is the second wave and now the third wave, with even more devastating impact on St. Lucia. There was a very, what I would describe as, it's simply unforgivable what they did, that when they were signed off the new wave in St. Lucia, to find scapegoats for it. The scapegoat then was the Labour Party had a march, and then it was a backdoor entry, rather than facing the reality that they had opened up to countries that had surging cases of COVID, and they needed to take very strict measures to make sure that if they were going to allow visitors to come in, they would not have the space where they can transfer the virus to our local population. And that was not done. And in a sense, we are paying the price for that. And even now, They are trying to blame St. Lucians for the spread. Again, not accepting that, government has a responsibility to take decisive action and targeted action to, one, mitigate any spread and certainly to prevent, the consequences of COVID. And you spoke of 13 deaths. I mean, one death is too many. And we can't get away with saying we must learn to coexist with COVID and that there will be people who will die. Every single death is regrettable, and we should have tried to avoid it.
Mm-hmm. I mean, very early on, of course, there was a lot of back and forth, as you did mention, or we heard about, issues of quarantine, and that, of course, that word became, something that we may have thought of more so when we were bringing in maybe pets and animal products. Quarantine became a very important term now if we're dealing with human beings in our lingo. And, of course, we heard about Quarantine Island, Rat Island, and lots of other suggestions. Do you think that we got a sufficiently good grasp of what we were facing even early on? I mean, yes, we were knowing things were changing all the time, but do you think we had a sufficiently good grasp as to what we were facing?
I think for us it's a very simple, analysis that we seem to have been doing well comparatively and absolutely. And we had to decide between whether or not we're going to open up and allow the tourism sector, the hoteliers, and certain businesses to once again thrive on the level at which they were, close to that level, or even to make up for their losses. Or do we keep the restrictions in place to safeguard our people? And the Labour Party kept saying, put people first, put the health and the lives of people first before you put it for profit and for business. And the government made its choice, and their choice was put business first. And the Prime Minister put it in stark terms. Why save lives if people's livelihoods have been affected? In other words, my primary responsibility is not to save the lives of St. Lucians. My primary responsibility is to save the conduits through which they have jobs, and that's the operation of the hotels and certain activities. And the government made its decision. They made a choice that they were going to put the business activity, the certain economic activity, above and beyond the lives of St. Lucians. That's clearly what they did. And we are facing the consequences of that decision.
Over the entire term of this government, it seems very early on, the issue of healthcare seemed to have been quite front and center. And I think it all started off maybe with the whole issue of St. Jude Hospital. It hadn't been completed by the Kenny Anthony administration. Coming into a new administration, that project got stopped very, very early on. And even though there was an argument, of course, that it was so close to being completed, and then we saw technical audits being done. We saw a whole new project, suggestions of demolition, back and forth. It took almost, over 3 years or 4 years nearly to be able to get that project back up and running. Then we saw, of course, what happened with the OKEU hospital. It also seemed to have gone into this mode of talking of privatization, and Health City Cayman. We also saw other things within the healthcare sector seeming to kind of change in their orientation. So once we were talking about universal healthcare, and now the whole conversation became about a national health insurance, and we heard about the possibility of private insurance being involved. Were we really dealing with a very symptomatic situation, a systemic issue, long before we got to COVID-19?
Well, you're absolutely right. In fact, what COVID has done is exposed the nakedness of the incompetence of this government as it relates to transforming the health sector. And you started off correctly. The electorate of St. Lucia penalized the Kenny Anthony administration for one of the reasons why they were penalized was not completing St. Jude and not getting OKEU fully operational. And people made a clear statement. We were dissatisfied with how you handle the health sector. You've done a lot of work, but you did not complete the journey. And we are giving another set of people a chance to complete the journey. But what they did was to almost decide we don't like the course we're running on, let's start all over again. And they've been totally and absolutely incompetent in that regard. So St. Jude Hospital has not been completed when it was 90% completed. They've started over a new structure that is really just a shell, and it is a shamble and a monstrosity in many respects. And we are worse off in the South than we were in 2016. And even OKEU. OKEU is run, although we moved in and occupied the space, with the same Victoria Hospital structure. And the government inherited legislation and all the proposals for the operationalization of OKEU as a statutory body. And we are worse off. So we now have occupied a modern space, but we are still archaic in terms of the management and the operation of OKEU. And now it is virtually overwhelmed by the situation we face. So what COVID has done, just like with the economy, because we were told the economy is doing very well, and that we were well suited to deal with all the challenges, and we're better than every other Caribbean country. And 2 weeks into COVID, we were told we broke and that we really cannot do anything. The same thing with the healthcare, that, you know, unfortunately, COVID came along and it has exposed in a very naked way the incompetence of this government as it relates to the health sector. And I think COVID has put tremendous stress, Alex, on the health sector now. And we probably at the point of being overwhelmed, and I think the Medical and Dental Association in their statement last night literally said we've reached our limit in the system. We have reached our limit. Now is the time for us to re-strategize and to reset. And they are absolutely right that we have reached breaking point, and we need to act decisively. And that's why last night the political leader delivered the address that he did. It was very heavy on recommendations, a 7-point plan for us to consider as we reset and we re-strategize to try to control this COVID situation.
He made the point that we've been borrowing quite a bit for COVID-19. I think about 320 million or so thus far. It's probably even more than that.
Close to 400.
Close to $400 million. And that's not borrowing for other things. That's just borrowing for COVID-19 related expenses. But we really haven't seen that much spending for COVID-19, have we?
Not at all, and that's what's so sad about it all, because, you know, a lot of those loans are policy-based loans, which means you're given some space in terms of the specificity of what you use those monies for. There have been some of those monies used for COVID. We were told so in the various debates in Parliament, but I don't think it was more than 20 million of the gross amount that has actually been used for, you know, direct medical or institutional expenses. For example, and sometimes you really wonder what this government is thinking. I recall during a budget debate, I was making the point that, you know, the VH hospital was painted and it looks fresh and new, and maybe was that the priority? Shouldn't we be spending more on enhancing the bed space and the amount of beds that are available? And, you know, the government was laughing and saying, oh, our VH has never looked so nice in its entire 100-odd years history. It's the best that it has ever looked. And they spend a lot of money on painting the outside of the building. And very little was spent on the inside, enhancing our capacity to bed persons who are required to be isolated. And you have to ask, was this the best use of the monies that we will lend in? We were lending, and it really, like you said, begs the question. Almost $400 million, you know, borrowed for COVID. And where is that money? How has it been spent? In the report that was presented to Parliament on the expenditures during the state of emergency, the report itself says, and it is prepared by the Ministry of Finance, that they're not in a position to even account for how most of the monies were spent. They had not received the information to be able to give a proper statement to Parliament. I mean, the law required them to give a statement after within how many months after the ending of the state of emergency, and Finance is saying, for goodness sake, we can't even really tell you how all the money was spent.
There seems to be a major line and push by the government regarding the issue of income support. Now, we saw it very early on. They didn't want to take on the responsibility of the income support through the NIC. There was a big issue of that, whereas many persons thought we had the former director of NIC, Ms. Emma Hippolyte. She was coming on saying, by right, it should have really been a loan because you really can't leave that massive gap in the NIC finances. But anyways, it went ahead. The NIC approved this spending. I think it eventually came up to about somewhere in the region of $70 or $80 million of income support. But in terms of the amount that government itself has actually provided, it's only about $17 million, I think, thus far. I mean, when you compare that with what other countries have been doing, I mean, even countries that are smaller than us, and I'm thinking one example that I know of, I've looked at, is the Seychelles in the Indian Ocean, similar tourism-based economy, and they spent about 140 million EC dollars, equivalent of that, on income support in the year 2020, and they're looking to spend another $100 million this current year on income support. But it seems as if there is some sort of philosophical issue with the government with respect to actually providing that kind of direct support to individuals. They seem to think that it's better to go the route of roads, and then that money will trickle down through jobs. What do you make of that?
No, but you're absolutely right. There's a problem with this government, a philosophical problem, like you said. They do not believe in putting people first. Nada, not at all. And a simple example, they believe that if you give people any support, it's mendicancy, it's handouts, and you should not borrow money to help people, because that's not what money is that are borrowed should be used for. And this is foolish. You need to secure people and ensure that they have civilized standards of living. So listen to this. They would use some of the monies that are borrowed from the World Bank, from the IMF, from the different international institutions. So if they receive 30 million US, rather than use it to make sure people are enjoying civilized standards of living, in their mind, it is better to give a company to build a mile of road that would cost $20 million. In that $20 million, the only amount that goes to the payment of salaries for workers is less than 10%. Less than 10%. So you're telling me.
So you're really only spending $2 million after you spend 20.
Precisely. So in terms of people, because they're now boasting, we're building the roads and people are getting jobs. Don't just see people on the road working and they're getting money, they're taking care of their families. But that's less than 10% of the money. The rest goes into markup for the companies, who are their friends, because they are direct award purchases. They're not even competitive spending. Some of it goes to importing stuff from overseas, inputs and whatnot that are needed, that loss of revenue. And you have to ask yourself, at the end of the day, I have borrowed $30 million. I've built 3 miles of road, 4 miles of road. And is that the best use of the $30 million in the present crisis that we are facing? Is it the best use of money? And some countries have taken a clear position, philosophical position, that we rather spend it on our people, whether through support to the vulnerable, the needy, the elderly, whether it is for creating community employment projects to make sure people in the community do community work and they get paid so they have money in their pocket to take care of their families, whether it is support to small businesses so they can continue to remain open so that they can employ people and provide services. No, they believe it is better to spend it on certain projects, and in their view, they can boast that they've employed 30 people on the road when less than 10% actually goes to be paying people. Now, this is a philosophical argument because they start off with the premise that we are not giving handouts to people. And I say to them, but you're giving handouts to companies. You're giving handouts to your friends. Put the people first. And you will notice in the 7-point plan, the rescue plan announced by the political leader of the Labour Party last night, number 7 was implement an economic and social relief program. Right. And from last year, March or so, we had outlined, provided details of what we believe would have been sufficient for the short term.
And in that proposal that you made back in March, I noticed that some of the things that were also included there were some targeted interventions for certain sectors, like fishers and farmers, but as well the creative industries. I'm not sure these are the silent sufferers right about now. Not very many people are hearing them. I mean, you would normally have been hearing them all the time because they're in music and entertainment, but we're not seeing. I again always go back to the situation in Germany. I mean, obviously the largest economy in Europe, but they actually had a very specific program for their creative industries, their culture and arts workers, because they appreciated that those individuals, by the very nature of their job, would have to be furloughed for a very, very long time. But it doesn't seem that we've gotten those types of targeted interventions to assist certain groups which are really suffering right about now. And
you see, and again, is the government and how it operates and how it thinks. the creative industries and individuals who are employed in the creative industries are so critical, but we don't see that as critical. For some people, it's a photo op, or it is just using them as influencers. At a time like this, when people are so frustrated, people are so emotionally burdened, people need to be inspired, they need to be motivated. Just think of you saying to people like Tennyson John and Ricky T and, you know, some of the other guys, and even some of the people in making music, you know, the Pens and them, that, look, we're going to give you a monthly stipend, not any big amount because you know the limitations, but can you cause activities online, virtual activities that can inspire our people, keep our people entertained, keep our people vibe up, keep their spirits up, keep them focused,
right,
and not allow them to descend into a state of despondency and despair. And they can do that. Those guys are creative people. All day long, they are in their head making music and thinking and relating to the circumstances that we're in. What's wrong in spending a couple $1 million and say to them, look, gentlemen, come together. This is your business. Keep the population on a certain vibe for us. Don't let it descend to the bottom level where people really start giving up on life. Keep them entertained, keep them excited. And that can be done. I'm sure those guys will do it knowing every month when they get a little stipend in their pocket, because the hotels are not as open as before. There are no public, no shows and no public activities for them to earn a living. But they are critical in the national psyche of our people and how our people carry themselves and believe in themselves and have hope for the future. Why can't we do that?
So I take it you would have probably had a virtual Calypso competition.
Of course.
If you were
of
the minister, wouldn't
course.
you? Okay.
Of course. Why not? Just imagine the excitement that would cause in St. Lucia. Just imagine the excitement of getting the Tennyson Johns to do virtual concerts and Ricky T and some of those other. I mean, I'm picking up those two because they're probably the two most popular, the Alpha Islands, and then to just do that and just keep your people at a level where they believe that we will overcome. We believe the future will be better for us. And to keep your population in that kind of mindset that we can overcome and we can rise to the challenge, and even use those guys to tell people to follow the protocols. I heard this argument, this nonsense about, our people too indisciplined and our people are the causes of the problem. Let me tell you, people all over the world are indisciplined. The reason why we have prisons, we have laws, we have judges and jails and policemen is because people are indisciplined and they break and they commit offenses. That's the nature of the human being. We almost live in a Hobbesian state of nature. So that's the nature of it. So don't tell me about people in discipline. You plan to overcome the challenge on the basis of understanding that people behave in a particular manner. Those guys can help us to appeal to people. It's one of the reasons why the Recover St. Lucia has a lot of positive aspects to it. It uses some of that. I think a lot more can be done, but I'm sure they're limited by resources. To reach out to people and to tell them and to educate them and to sensitize them to follow the protocols. Every piece of help we can get, we should utilize. Yeah. And we have not had that kind of thinking, because if you do that, you're giving out handouts.
Dr. Hilaire, I want to segue back into the issue of tourism, because that clearly has been a major crux point of debate between the opposition and the government, and the argument effectively that, you need to get tourism back up and running. It's half of the economy. It really matters in terms of jobs, 14,000 jobs dependent on it in hospitality and restaurants and bars and what have you. And that seems to have been the major focus of the government. And then, of course, there's that other argument that is at play that, look, you still have another half of your economy going. Should you risk losing that other half by trying to bring back a little bit of that other lung, which is tourism? We don't have very much time because we actually have to go to our weather break. So I'm not sure if you want to touch on that maybe when we come back on the other end of the weather.
Okay, let's go.
Okay, wonderful. And welcome back to the lunchroom this Friday, and we're speaking with the first deputy political leader of the St. Lucia Labour Party. He is Dr. Ernest Hilaire, and we're discussing COVID-19. Of course, it's almost a year since the World Health Organization, a year to the day almost, they declared it a matter of international concern, a public health emergency of international concern. And it's also the anniversary of the second anniversary, in fact, of a motion of no confidence which the St. Lucia Labour Party brought against Alan Chasney, the Prime Minister of St. Lucia. So interesting times indeed, Dr. Hilaire, and certainly that major debate which has been going on for quite some time, the issue of tourism versus the rest. And it's an unfortunate debate, no doubt, because, of course, tourism does employ thousands and thousands of people in St. Lucia and has been our major economic driver for quite some time now. But clearly, there are some really major risks regarding it, and it has, in fact, been the most affected of all sectors globally to date.
Well, you are absolutely right. I think it is universally accepted, maybe only in St. Lucia it is not, that international travel is a major source of spread. And I mean, I think that's accepted. I mean, look at New Zealand last week. New Zealand had not had a case for months, and there was a new case because somebody who had come in from outside, and despite being quarantined, still tested positive after. But the point is, we have to accept that the international travelers coming in is a source. I did not believe that the discovery of the UK variant in St. Lucia really and truly originated from within St. Lucia. It had to have come from the UK or somebody who had been in the UK. And I certainly we don't buy this backdoor argument anymore.
Well, I think some people even suggested that the St. Lucia Labour Party had brought down some UK nationals to their march.
Really?
I think I even saw that somewhere out there too.
Except that the UK variant was not there at the time when we had the march.
Well, at least anyway, unknown, certainly.
Yeah,
yes.
Yeah. So I mean, we have to deal with it. There has to be a very clear understanding that if we are going to allow persons to come in, we have to have stricter measures on control on those people. There's no two ways about it. Our preference would probably be that persons from those highly affected countries do not travel to St. Lucia. And I think that point was made last night by the political leader. But we also recognize that, yes, there is the economic reality that we have to face. But if you are going to do so, then surely you must put in place the measures and the controls to protect those people who work in that industry. The same industry you say you want to exist because you want to protect their jobs. Just one final point. And I also believe that we should be guided by the science and the medical people.
And that's what I was coming to, in fact, because I'm thinking that it almost felt that we were taking a leap of faith. Somehow we may have believed that tourists were not human beings, and somehow their incubation periods were different from the average person, because there effectively is no real quarantine for visitors coming into the country. Is there?
There's none. There's none. You go to your resort, and I'm told that they expect them to remain at their resort, except for the specially organized tours and outings. But that's not the case. There are people that go out from certain hotels. There are people that go out.
But even forgetting about going out, even if they were to remain on property, effectively they're still mixing and mingling. I mean, they're not being quarantined to their rooms, or they're mixing with other tourists. They're mixing with staff. There's pools and bars, and all of that is going on in that type of setting. Parties going on property.
Well, again, it's a major source. It's a major concern for us, and action should be taken. But you know what's going to happen, Alex? 2 points. We do not want to close our borders to those countries, but they are going to do it for us. Mm-hmm. They are going to tell their nationals, and it's happening now. We heard what Boris Johnson said in the House of Commons yesterday, that the stay-at-home order in the UK requires UK nationals to stay at home and only travel if there is a valid reason to travel, and leisure is not one. And that they will be at the port asking you, why are you traveling? And if you cannot show a valid reason, they'll ask you to go back home. And I think this morning, and we will verify it shortly, we heard in Canada, they virtually, suspended all flights to the Caribbean until later on in the year, from what we are hearing. Yeah. I think until sometime in April.
Well, I think we were already affected, weren't we? Because I think they already have cut back flights from Canada for St. Lucia even before this.
Yeah. So, I mean, these countries are now going to tell their nationals, don't travel. do not travel. Of course, the U.S. might be slightly different because of this the structure in the U.S. So we are very clear in our minds. And again, the political leader announced it last night when he said we need to rethink the travel and tourism measures, that we should not be allowing persons from those stricken countries to be traveling to St. Lucia. But again, he's advising the government, if you all insist on doing it, then for goodness sake, put in place some very rigid and strict controls and measures. And I think also we have to pay regard to the fact that the Medical and Dental Association, who are medical practitioners, are saying to the government, we need a judicial shutdown right now. We need it. And I think implicit in that is saying to the government, you have to take cognizance of those sources of the virus and to shut it down as much as possible. So I think the science is now saying it should be done. The practitioners, the professionals involved are saying to the government they need to take more action. The Labour Party is saying to take more action. The government has to act. The government, sometimes I wonder.
Do you think, and this is a real and serious question though, do you think that there is too much control or influence being brought to bear or bias effectively by persons sitting in the government because of their affiliations or past affiliations with tourism or, more in particular, certain properties?
Well, I believe the agenda is not the people's agenda. I believe their concern is not the welfare and the well-being of the people of St. Lucia. They are masking it by saying that they want to save livelihood, but it's not about saving livelihood. It's about saving as much as possible the business of certain interests in the country. And I have no apologies for saying that. They are protecting as much as possible the business of certain interests in the country.
Do you think Dominic Fede, the Honorable Dominic Fede, Minister for Tourism, do you think he should be the chair of the command center for COVID-19?
Well, I don't have a problem with that per se, because if they believe he has competence within his government, if Dominic Fede is the most competent minister to chair it, it says a lot about the government, but that's their business. The point is, Dominic Fede should pursue an agenda that puts the people of St. Lucia first, the health of the people of St. Lucia, the welfare of the people of St. Lucia, and the safety of the people of St. Lucia first and foremost. We're not saying disregard all other interests, but put the people first. And surely, Khalek, it cannot be too much to ask. And the political leader asked it last night. If you are going to let people come in to St. Lucia, put in place strict measures and controls to insulate our people from any viruses that are brought into the country. How can that be too much to ask? How can you care about the people of St. Lucia and not see the inherent logic in that?
We've seen some major changes, of course, in the United States of America, CDC, placing us, we were at one point level 2. I think we're now up to level 4, the highest level in terms of warning for their own citizens not to travel to St. Lucia. We've also seen all our source markets, the United Kingdom, Canada, as well as the United States introducing the requirement for pre-testing for return to those countries for persons who have traveled. I mean, we're clearly seeing that even the countries that we are bringing people in from, these high-risk countries, are putting their own restrictions on the rest of the world, even though they have lower risk. And we seem not to be willing to put any requirement at this point for testing on arrival.
Alex, if this was not a matter of life and death, it would be a real good comedy. Just think about what you've just said there. That we are not stopping them from coming in. We are not putting strict measures on them coming in. But their authorities are saying, by the way, when you go to St. Lucia, make sure when you come back, you prove to us you don't have the virus. Eh? Just imagine that. And the CDC ranks us at the highest level. So they are saying it, telling their nationals, we don't think you should go to St. Lucia. We are saying we are not putting in place the strict measures, although they are the worst affected countries. And they are saying about us that are better off than them, tell the people don't go to St. Lucia. How more foolish can that be? And then secondly, we cannot expand the testing to make sure we get a true picture of the extent of the problem in St. Lucia. But we are boasting we can provide testing for all the visitors that have to go back to their countries.
And that already is impacting on our ability to deliver on testing. The backlog that we're seeing right about now, I think nearly at one point 1,000 tests backlog. We're doing tests a week old already, my understanding. And clearly, part of that problem is that priority is being given for persons who have to travel. They're paying, and they want to be able to get their tests done so that they can travel.
Yeah, let me tell you, Alex, the situation of testing in St. Lucia is a serious indictment and is a weight on the moral conscience of the people who are making those decisions. I am sure that the WHO and PAHO would have provided guidelines and protocols for the use of rapid testing. They are in place. Why can't we use it officially in St. Lucia? Mm-hmm. There must be protocols on the WHO and the PAHO, and we have been told that there are thousands of rapid testing kits available to the government of St. Lucia to use, but they are not going to use it because they probably believe, I don't know, I'm not going to pretend I know their thinking, but I know these countries are accepting it for the nationals that are returning. Right. There are protocols established by the WHO, PAHO, as to how to use the kits and how to interpret the results of the kits. Mm-hmm. Why are we not using it? Why are we allowing St. Lucians to be in a situation where testing is almost a week backlog? Almost a week backlog. I had somebody who said to me this morning, they got the results last night and they were tested positive. There are people that have been in quarantine for a week going on, waiting for their test. Or
rather, they should be in quarantine, Dr. Hilaire, because in many instances they're not in quarantine, and that's the problem.
Yeah, well, these people have been. Okay. They have been in quarantine waiting, a week going on. Mm-hmm. They're now told that they have positive, their result was positive, and they're now being told as if they have to do the 14 days quarantine. I mean, it's almost comical. Mm-hmm. And the point is, why can't we not enhance our testing capacity to make sure we test as many people as possible and get a true picture of where we are in this country? And we just saw what Barbados is doing. Mayor Morton and the government has taken a decision that they will do a complete island-wide test to really understand who is affected, who is not affected, and to try and put it under control. We are refusing to do that in St. Lucia. Refusing to do it. And you know what also is happening quickly, Khalid? Now persons who have been in contact or in close contact or contact trace or whatever, for them to have to wait so long to find out if they have to get their results, they'd rather go to private testing.
Mm-hmm. But in fact, we did actually hear, well, there was a press release, I think a day or two ago from the Department of Health and Wellness indicating to persons that even though you have a positive rapid antigen test result, you still have to get a PCR result. Now, I thought that was a little interesting because from what I know, I mean, yes, we do know that the rapid antigen is not as accurate as with respect to the PCR testing, but then for symptomatic people, it usually will show that they are positive if they are positive. So it was a very interesting point. I know normally you would want to verify the negatives, but not necessarily the positives.
Exactly.
But that seems to have been a note coming out of there. Now, of course, there were a lot of recommendations made last night by the leader of the opposition, the Honorable Philip J. Pierre, and of course, a lot of it had to do with testing. But we've seen now the appeals coming out of the St. Lucia Medical and Dental Association. I think there's a suggestion out there as well that the Bankers Association may be thinking the same thing, that there may very well be a need for an island-wide shutdown of some form or fashion. And just to go through the numbers very quickly for the benefit of individuals, in the first week of January, we saw 30 cases. In the second week, we saw 160 cases. In the third week, we saw 211 cases. And the week just ended, Thursday, from Friday last week to Thursday yesterday, we saw 351 cases. The rate of increase is actually going up right about now, Dr. Hilaire. I think we're now at about 50 new cases per day. Do you think that it is time for the country to have that conversation about shutdown? Because it does not appear that the government has any interest at this point in time in a collective pause.
Well, we have no choice, really. And I think we need to have a shutdown in a form described by the political leader in his address last night, that we need to rethink, revise the partial shutdown. We need to have a dialogue. So it cannot be done the way it was done the last time. It was unfair, it was draconian, it was an abuse of people. You can't just wake up and say, I have a shutdown from tomorrow. I mean, look at how Barbados has done it. Not that it will eliminate any panic reaction, but the point is you give people a certain amount of time to get their house in order, and then you shut down and you control the situation, and then when you satisfy it's under control, you reopen. At the same time, you think of the critical necessities that need to be supplied and how they're going to be supplied. So there's a rational, systematic way in which you can do it. And the point is, let us listen to the science, let's listen to the technical people, the medical practitioners, to tell us what's the best way to do it and how to do it. And we believe the present status quo cannot continue. The statistics you just gave is frightening, Alex. It's frightening. There's also a story we're not really hearing, and the media does not seem to be capturing it well. What's happening at OKEU and what's happening at
Victoria
DH.
Hospital, yeah.
And I mean, we all know that there's certain guest houses, at least one that I know of, that's been used to isolate patients. Mm-hmm. We call for an isolation facility in the south now, although I think about 75% of all cases are in the north, between Cassius, Grosley, and Babono. But, I mean, you still have pressures on on VH. Now, that's not even been carried in the media and whatnot.
Well, it's difficult because I'm not even too sure in terms of access. I mean, you know, we saw images during COVID-19 of Italian hospitals and the UK hospitals, but I'm not sure how willing, there's going to be for the authorities to actually allow for the media to go in to actually see the condition of what is things going on in Victoria Hospital. But you're hearing some very scary stories about treatment. Sometimes you get some patients coming out and actually doing their own vox pops, providing information as to their treatment. And there's a genuine fear from a number of individuals that they simply don't want to go and isolate at Victoria Hospital.
They don't. They rather stay at home, and that's what can cause more deaths, Alex.
Yeah. Because
they're at home, by the time they deteriorate and their health conditions get so bad, it's too late for them.
Yeah.
But, Alex, whilst we're discussing getting the situation under control and reducing the spike in cases, at the same time, we must have some parallel thinking going on about the vaccination program. Mm-hmm. Because we cannot get so consumed in dealing with the present situation, we do not prepare for the vaccination program, because our safest bet at the end of the day is a vaccination for those who are willing to take it.
Do you suspect that that's the thinking of the government right now, that maybe they figure, we're supposed to get our first batch from COVAX somewhere around the end of March. It might only be about 3% of, maybe about the equivalent to cover about 5,000 people. So let's try to hold on. Let's try to keep the economy going, because we really can't afford to shut it down, and we'll just try to continue going. You think that's the thinking right about now at the government level?
I think that's what it is. And I think it is even more sinister than that, in that they don't mind, okay, we have to deal with some collateral damage, so let's learn to coexist. I mean, it's a very cynical and sinister way to treat your citizens. Mm-hmm. That, you know what, let's learn to coexist with this. It's part of the reality. Let's just live with it, okay? The vaccine will come one day. We'll vaccinate as many people as possible, and we will curtail it. And along the way, there might be some collateral damage, so let's just learn to live with it. But I don't know that is how we should approach it. I think I'm sure that's not how we should approach it. And we are calling on the government. And again, we go back to the political leader's address last night, his 7-point plan. Basically, expand testing and tracing, expand treatment capacity, rethink travel and tourism measures, revise the partial shutdown, protect our education sector, quickly implement a vaccination program, and implement an economic and social relief program. And under each one of them, we have specific recommendations as to things the government ought to do, some of which has already been done, but we believe they should be enhanced or expanded. Mm-hmm. We need to get this under control, or else more people will die, and the health sector will be overwhelmed, and we will be the worse off for it. It will make the recovery harder. So whereas you believe by taking limited action that you might be safeguarding the economy and the future, the destruction caused by inaction now might make that recovery even harder for you.
Well, it almost feels as if we're now into the hangover phase of what's going on. I mean, we had a fairly good Christmas, if you want to call it that, with respect to tourism arrivals. I think we were, according to the Prime Minister, we got about 45% of what we would normally have gotten. Based on the 2019 figures, we got about, I think, 15,000 or so visitors coming in. But since then, the numbers have all plummeted in terms of arrivals. As you've, of course, mentioned, the UK and Canada are not really happening. You're even getting cancellations coming out of the US. And it's not a very, very good month, the month of January. And then not only that, we seem to now have been left with this massive spike of COVID, which has even shut down some hotels, hasn't it? In the case of, I think, the Royalton shut down up to 60 cases right there in one property.
I'll tell you what will happen. The government will end up having a shutdown cost on it. Because when the numbers get so low in the hotels, especially the favored ones, then they will have no choice but to act. Because it will make no sense in any event. So they would have to do it. Now, we want the hotels to operate. They are a critical part of our economic growth and development in this country. Our issue is the welfare, the safety of solutions should be priority at this point. And like you said, we take no comfort in knowing that people are dying. We have to do something about it. You cannot be leading a country and people are suffering and COVID is spreading, and you're taking comfort in the fact that you had significant arrivals in December. The same people that were demonstrating in other countries against wearing masks, we are telling them to come and chill in our country. We don't have strict requirements. You know, that's what we're doing. For us to be able to boast that the hotels stayed open and how many thousand people were still working. Come on, there are people dying.
Well, clearly, a major hotel has already closed, and we're also seeing a lot of businesses suffering as a result of COVID-19 closures. And they're certainly also being affected by the testing and the lack of testing, the length of time that it is to get testing done. And they now have had to resort to getting testing done privately at this point in time. So we already are seeing that the economic impact of COVID-19 occurring in the rest of the economic of the economy.
Precisely, and the point is, we now have to call for stricter measures. If the government had not gone so relaxed like they did, we would not have reached this stage. So we could have coexisted in a sense. We could have, but you coexist with strict measures. We were one of the first calling on the government to open up the local economy and then open up to the regional economy and then to countries that are not severely affected by COVID, to international countries. We all those things are documented in terms of the Labour Party, calling on the government for those matters. Do not yet open to the countries that are most affected. We kept saying that. How can you expect to open up our borders to the United Kingdom, the United States, that have major spikes, and do not expect it to affect you? We said so. And we were told, oh, you all want the economy to crash. You all want, things to mash up in the country. And I heard the Prime Minister last night doing it was a repeat carried by somebody somewhere about, if he did not try and save livelihoods, things will be so bad in the country, we'll be having riots and all those kinds of things.
Yeah, I think the ships won't come in with food and that sort of stuff.
Yeah, I mean, that's a kind of illogical rationalization that, I don't know, that's probably an oxymoron. You can't have illogical rationalization. But, that's the kind of thinking that is pervading this government. And I'll tell you something, it is a deliberate thinking because it is designed to protect certain business interests. That's what it is all about, to the detriment of our people.
What is the strategy? I mean, we've heard from the political leader of the St. Lucia Labour Party and leader of the opposition. He's laid out some proposals, and very numerous proposals. We've heard from the St. Lucia Medical and Dental Association. I'm not sure if we're going to be hearing from other associations moving forward, maybe unions. Do you think that there has to be some consensus building at this point in time as to the way forward? Because it seems as if there's a bit of an impasse right about now as to what is the way forward. We heard in the case of Barbados, the Honorable Mia Motley saying that, look, it's going to cost the island, I think, about $25 to $30 million or whatever it is for that shutdown, loss of revenue, but it's necessary at this time, from what she's saying. And Barbados actually has somewhat better figures than us. It has fewer active cases, and the rate of increase is not even as great as ours right about now, and they're heading to a shutdown. Are we going to be just waiting, you think, until it gets to an even worse crisis proportion than it is already, or is there going to be some further action from the St. Lucia Labour Party and other players?
Well, I mean, we've made our proposals known last night, and we will disseminate it in the public so people know clearly what it is we are recommending. We will be lobbying other social partners to put pressure on the government, to call on the government to take decisive action. We're not saying our plan has to be the plan, but we are saying that's what we put in forward for consideration. We hope other social partners will make their suggestions, like the Medical and Dental Association did, and we also hoping that they will lobby the government to take decisive action. And other civil society organizations will call on the government to please take necessary action. And hopefully the government will respond to the arguments put forward to them, and good sense will prevail. And if they still do not want to do it, then the international circumstances, whether it's the actions by the UK, by Canada, by the US, will force the government to realize that they have no option but to act in a particular way. And they will also, some of the interests that they are protecting, or at least trying to assist, will see that it makes no business sense to operate in the present environment, and to persuade the government to act accordingly. And then, of course, the government will make it look like, oh, we are taking action and now is the right time to take action. The point is the right time has passed. It is late, but we can still do it to mitigate the situation that faces us right now. And we have to continue to call on all civil society partners to put pressure on the government, to lobby the government to act in the best interest of St. Lucia.
Dr. Ernest Hilaire, thank you so very, very much for being my guest here today at the lunchroom, and for, of course, giving us a sense as to what was discussed last night in the address to the nation by the Leader of the Opposition, Honorable Philip J. Pierre, and, of course, giving us your thoughts regarding the COVID-19 situation and how we can perhaps move forward to address it. It is certainly a very critical matter, no doubt, and we're coming to the end, I think, of that 10-day period of new protocols. Yeah. I think Sunday is the day, and if we were to go by on that basis, schools would be opening next week, I believe. So
that's supposed to open on Monday.
On Monday, and we haven't heard anything of late in terms of a new way forward. So I suppose we'll hear something soon, hopefully.
Yeah, and Calix, before you go, I mean, today is also the second anniversary of the tabling and the debate of the no confidence motion in the House. And, of course, it reflects what we were saying 2 years ago, that the government had demonstrated gross mismanagement and incompetence. The Prime Minister, as the leader of the government, should have resigned by then. And, of course, all his parliamentarians supported him. And one of them even said that we are all Chasnays. I mean, I don't think it's so much the name in as much as saying that if you all are criticizing the Prime Minister, we all like him. We are all in the same boat with him. And 2 years later, we are witnessing the dramatic consequences of the mismanagement of the COVID pandemic, consistent with the behavior of this government since they got into office, and why 2 years ago we had to table the no confidence motion.
Well, let's hope that we're all in for the protection of life and good health this time, certainly. And thanks so very much again, Dr. Ernest Hilaire, the Member of Parliament for Castries South and the First Deputy Political Leader of the St. Lucia Labour Party.